Hello friends, in this video we are going to talk about the necrosis. It is an irreversible cell injury. Basically, necrosis is a morphological changes which are indicative of cell death in a living tissue following harmful injury. Basically, necrosis results from the degradative action of enzymes on the irreversible injured cell. It brings out acute inflammatory reaction in the surrounding tissue. Because of the necrosis results from damage to cell membranes and loss of ion homeostasis. The necrotic cells cannot maintain the integrity of membrane and their contents leak out. So it leads to the acute inflammatory reaction. If we see the cytoplasmic changes, it has increased eosinophilia, it is homogeneous and moth-eaten appearance is also seen. Now, light microscopy findings, pycnosis, karyolysis and karyohexis. Pycnosis means the shrinkage of nucleus. Karyohexis means the progressive fading of basophilic staining of the nuclei and leads to a ghost nuclei, while karyohexis means the nucleus breaks up into smaller fragments, as you see in the diagram that nucleus is fragmented into smaller parts. Okay, now inflammatory reaction is also seen in the surrounding tissue in the necrosis. Now, electron microscopic findings that dilatation and amorphous densities in mitochondria, amorphous debris of cytoskeletal pyknotic nuclei, as we have discussed, discontinuities in plasma and organelle membranes, myelin figures, and leakage of contents. So, these are all the features of the necrosis. Now we will discuss about the types of the necrosis: coagulative necrosis, liqueficative necrosis, fat necrosis, caseous necrosis, and fibrinoid necrosis. So let's start with the coagulative necrosis. It is a common type. Outline of dead tissues is preserved, at least for few days. In fact, is a localized area of coagulative necrosis. Causes are the ischemia caused by the obstruction in a vessel. Its mechanism is ischemia denatures and coagulates structural proteins and enzymes. The organs affected are all organs except the brain, but more frequent are the heart, kidney, spleen, and limb. In limb, it causes the dry gangrene. Microscopy is indistinct outline of dead tissue. Nucleus may be either absent or so karyolysis. One point you have to remember: tombstone appearance is seen in the tombstone appearance is seen in the coagulative necrosis. Here you can see the wedge-shaped infarct in the kidney. Now, the another one is the liqueficative necrosis. It is mainly seen in the central nervous system. So, dead tissue rapidly undergoes softening and transforms into a liquid viscous mass. Okay. Its causes are ischemia, injury to central nervous system, and suppurative infections such as bacterial infections, which leads to the accumulation of leukocytes. So what is the mechanism? Mechanism is that liquefaction is due to digestive action of the hydrolytic enzymes released from dead cells. It is called autolysis, and due to the leukocytes, it is called hydrolysis. Now, organs affected are the brain. Necrotic area is soft and centers of liquefaction. Abscess anywhere, localized collection of pus. The third one is the caseous necrosis. It is a distinctive type of necrosis which shows combined features of both coagulative and liqueficative necrosis. Okay, it is a characteristic of tuberculosis and is due to the hypersensitivity reaction, as we all know. Organs are affected. Tuberculosis may involve any organ, most common in lung and lymph node. Appearance: necrotic area appears yellowish white, soft, granular, resembles dry, clumpy cheese. Hence the name caseous cheese-like necrosis. You have to remember the terminology cheese-like appearance. Okay. Here you can see the appearance of extensive yellow white uh, areas of necrosis. Okay, it is seen in the tuberculosis. Now, if you see the microscopic features, focal lesion of tuberculosis is a granuloma, which may be caseating soft granuloma or non-caseating hard granuloma. So here you are seeing the granuloma formation. Okay, in center there is caseous necrosis. Then there are epithelioid cells. Then here you see Langerhans giant cells, and here lymphocytes and fibroblast. Caseous necrosis appears as eosinophilic coarsely granular material. In caseous necrosis, necrotic material may undergo dystrophic calcification. Caseous necrosis with granuloma is seen in the tuberculosis and histoplasmosis. Other infections such as syphilis and leprosy and many other conditions which is associated with the granuloma. Okay, either it will be the caseous necrosis or non-caseating granuloma. Sorry, caseating granuloma and non-caseating granuloma. So now we will talk about the fat necrosis. It refers to the focal areas of fat destruction which affects the adipose tissue. There are two types of fat necrosis. First one is the enzymatic fat necrosis and the other one is traumatic fat necrosis. Enzymatic fat necrosis occurs in adipose tissue around acutely inflamed pancreas in condition known as acute pancreatitis. In pancreatitis, the enzyme, mainly the lipase, leak from acinar cells and causes tissue damage. Now, what happens is that lipase destroys the fat cells and liberates free fatty acids, which combine with calcium and form calcium salps. Fat saponification. It appears as chalky white areas. Here you can see in this image that chalky white areas you can see in this image. Now, microscopy, the necrotic fat cells appears pale with shadowy outline surrounded by an inflammatory reaction. You have to remember that traumatic fat necrosis occurs in tissues with high fat content like in breast and thigh following severe trauma. Enzymatic fat necrosis associated is associated with enzymes, while traumatic fat necrosis is not mediated or associated with enzymes. Here you can see the microscopy of fat necrosis. Fat cells with shadowy outlines and opaque cytoplasm. Okay, and some inflammatory cells. So now let's talk about the fibrinoid necrosis, characterized by deposition of pink staining fibrin-like proteinaceous material in the tissue matrix with a staining pattern of fibrin. But remember, in fibrinoid necrosis, necrotic material is like similar like fibrin, not a fibrin. Okay, so remember that point. Causes are the usually seen in immune mediated. Basically, deposition of antigen antibody complexes in the wall of vessels. Then vascular injury, vasculitis, polyarteritis nodosa, malignant hypertension, ESCOF bodies in the rheumatic heart disease, Byzantine preeclampsia, and or hyperacute transplant rejection. So these are the causes of the fibrinoid necrosis. Immune mediated type 3 hypersensitivity is immune mediated. Okay. Now, fibrinoid necrosis is seen in immune mediated diseases such as polyarteritis nodosa, malignant hypertension, autoimmune disease such as SLE, and rheumatic fever. Risk of body is in rheumatic fever. So this is all about the necrosis and types of necrosis. Hope you enjoyed the video. Thanks for watching.